Hello, my name is Mechthild Becker, and together with my colleague Julia Blocher, I will present our lightning talk titled Health Impacts of Climate-Related Human Migration and Displacement, Lessons from 9 Island and Archipelagic States. This presentation is based on a report produced by the Potsdam Institute for Climate Impact Research, together with the German Corporation for International Cooperation, GIZ. Together with the researchers from the University of the South Pacific, University of the Philippines, Visayas, and an independent researcher from Trinidad and Tobago, we conducted 94 expert interviews in 9 island states. In this presentation, we focus on the insights from the Eastern Caribbean. In the Caribbean, the hurricane season of 2017 led to unprecedented numbers of climate-induced displacement and migration in the region. Interviews reported that this drew attention to the need to address human mobility in the context of climate change, and that it has shaped intra-regional collaboration in a positive way. Currently, only Dominica has developed a strategy to relocate people away from hazard-exposed areas. Besides this strategy, no explicit policies or guidelines exist that address climate-induced migration on a national or regional level. We found that regional intergovernmental organizations like the OECS or CARICOM that facilitate inter-island mobility in general help to strengthen resilience. However, in the interviews with regional and national level actors, it became evident that the capacities of involved agencies were overstretched in the hurricane season of 2017. This resulted in insufficient care for displaced people, as well as high stress for agency employees.
While the experts and key informants from the 9 island and archipelagic states we studied gave us specific accounts of challenges and opportunities that they face in addressing human mobility in the context of climate change, a number of common gaps in knowledge and policies emerged. Some of these were related to the impacts of climate change on morbidity, mortality, and physical security, which we highlight here. For the Eastern Caribbean, the narrative is generally that sudden onset hazards like cyclones lead to displacement, while gradually developing hazards like drought or sea level rise prompt migration and may eventually precipitate the planned relocations of people. During and in the immediate aftermath of a natural hazard, migrants and especially displaced people are at a higher risk for issues that can severely affect their health, such as malnutrition, dehydration, waterborne diseases, and many more issues. And they're also at higher risk for problems that can impact on their physical security and have implications for health, such as human rights abuses and the physical impacts of flooding and landslides, etc. Experts in the Caribbean explained that many health and physical security concerns affecting people on the move go underreported and untreated because of general limits to data and because many of these people are absorbed by host families in urban areas. These data and knowledge gaps persist after a climate event, and there is limited migration data in general in this region, which means there is a limited understanding of how climate-related hazards affect morbidity and mortality in the medium and long term. Limits to data and research are even more prominent on the impacts of gradually developing hazards than for sudden onset events, but it is clear that the nature of work in the Caribbean is vulnerable to climate change, especially for those working in the tourism sector or in outdoor work. Even more prominent in our interviews in the Eastern Caribbean than the physical health and security concerns were the impacts of climate change on mental health, which we highlight here. Again, there are different dynamics for sudden onset hazards as compared to gradually developing ones. Importantly, the trauma experienced during the 2017 hurricane season remains palpable in the population in the region, and the limits to government and to the healthcare sector capacities means that many people who experienced trauma and were displaced continue to live with the trauma and related effects. Social and cultural norms are important here as well, as men and older people are generally less likely to seek help. Already today and in the longer term, the gradual loss of land and overall changes to livelihoods encumbered by climate change have major impacts on mental health. Place attachment and land disarticulation are more prominent in areas governed by customary land tenure, such as in Barbuda. For these people, ancestry, culture, community, and identity are inextricably linked to land. Of the 9 countries studied, The common challenges expressed by interviewees led us to develop 5 broad categories of recommendations, which you can see here on the slide. For the Eastern Caribbean, we focus here on some specific points for categories 2 and 3. For number 2, risk diversification strategies, we recommend that governments can, for example, improve safety net mechanisms for losses and damages in the context of extreme weather, which can help families meet immediate health and nutrition needs. For number 3, data and knowledge improvements, governments can include migration questions and census surveys and train immigration officials on the specificities and needs of migrants and displaced people, including their health conditions and needs.